Okay, hello. So now we're going to discuss how to do an inline. We call it inline because it's inline the circuit, an inline nebulizer treatment if someone is on Bipap. Now I would say as a general rule, when patients are on Bipap, they are getting positive pressure, they're getting assistance to their breathing. I can't really imagine this happening too often where the therapist isn't around and the patient is just desperate for a breathing treatment. But obviously it could happen, so we want to go ahead and discuss that right now. So I will describe two ways that we do this. One, the first way will be what I call the preferred way, and then the second way is the non-preferred way, I guess. But sometimes we have to make do, right? Because maybe the preferred way, we have a limited number, so maybe they're all in use. So then we have to do the non-preferred way, but it's still a good way to do it, even though it's not preferred. All right, so let's just look at the circuit. So here we have our Bipap machine, our non-invasive ventilator, and the circuit coming off of the humidifier. And then it comes up to the little orange elbow, and then here's our mask, right? And it just kind of fits like that. Well, you notice there's also a little extra thing right here. This is called the inline aerogen nebulizer. And so you can imagine the patient's resting in bed, so it kind of looks like, this. And you're thinking to yourself, well, Tim, why on earth is this extra heavy piece of equipment right here? Well, the reason is, when we do an inline nebulizer for someone with Bipap, we want to make sure that the nebulizer delivery system is as close to the mask as possible. Because you notice right here, this is the exhalation port. So if I had the nebulizer on this side, the machine side of the exhalation port, when the breath is being delivered, some of the medication is going to be lost out the exhalation port. So we have to put it up here, distal to the machine from the port, so it's closer to the mask. So now when a breath is delivered, it's going to go to the face and be inhaled in the lungs. Now, will we still lose some medication through the exhalation port? Yes, we will still lose a little bit, but not nearly as much as we would if it was on this side of the exhalation port. Now, there are times when the respiratory therapist may have this in the wrong location. And it's a process, right? So we're all trying to learn. So just because this device may be down here somewhere, don't worry about it. Just still go ahead and follow the steps that I'm about to describe, okay? But I just wanted you to know that the ideal position would be as close to the mask as possible. If it's down here, do I want you to move it up to here? No, just leave it where it is and do the inline treatment. All right, you notice there's a wire coming off this nebulizer, not a oxygen tubing like on our standard nebulizer. This is a wire because this aerogen is an electric wire mesh nebulizer. So the wire will connect, if we follow it down, it connects down here to the controller. This is the controller. This is where we, instead of on the regular nebulizer, we would turn the flow meter up to 7 or 8 liters a minute. This is where we just hit the button and it causes that vibrating mesh to vibrate. And as the two pieces of mesh vibrate together, they will nebulize the medication. Okay? Bunch of fancy stuff that is neither here nor there, but it's interesting, so what the heck, let's talk about it. So you'll see there's a power cord, and it's got to be plugged in, obviously, because there is no battery for this. It's got to be plugged in or it's not going to work. So shifting our attention back up to the inline portion of it there, by the mask, you will see that there's a little cap. We just lift the cap up. And in fact, I can show you that this part disconnects, okay? So when we put it together, we have to actually physically put it together. We have to assemble it, just like our other nebulizers. So now we've got our ampule of medication. We'll pretend that this is our ampule of medication. There's a hole right there where we will put the medication in. Just put a little bit of medication in there. Pretend placebo. We'll put the cap back on. So rubber cap is all. And I'm going to disconnect this just so you can see how it works, okay? So I'm going to come over here, I'm going to push the button, and I'll put this by my blue shirt so hopefully you can see it. I'll push the button. There we go. Sometimes you have to tap it. And now hopefully you can see the nebulizer coming out, okay? So whenever you have it in here, you put the medication in, and you hit the button, you always want to look in this space right here to see if there's a cloud forming, okay? Because as you noticed, I had to tap it once or twice to kind of get it going a little bit. And so that's just how these vibrating mesh nebulizers work. Sometimes you just have to kind of kickstart them a little bit with a tap. Well, now you can kind of see it's a cloud, it's condensations forming. So now if I had the V60, the Bipap machine turned on, you would see it all coming into the mask, and actually you would see in the mask a little bit of a cloud forming during inhalation. And that way you know it's working. Now obviously this aerogen is gravity dependent, and I'm going to turn it off for just a moment. So the vibrating mesh is right inside, I don't know, you probably can't see it very well, but it's right inside there. So it's at the very bottom here of the well. So the question is, well, Tim, if I have this circuit on the patient so that this well is like that, is it going to nebulize? Well, of course it's not going to nebulize because it's not anywhere near the vibrating mesh at the top. So that's why we have it angled the way that we have it with the patient laying in bed, okay? So the angle is down, the vibrating mesh is at the bottom, so when we hit the button, we kind of tap it. There we go, now the cloud is forming. We can kind of see it escaping at the bottom here a little bit. You can see that now it's going to nebulize completely, okay? If the patient is sitting upright in bed, the well is still at the bottom by the vibrating mesh, and it's going to be just fine, okay? But if it were to be like that, well, obviously that's not going to work, okay? So there we are. So that's how you don't have to worry about turning it off. It will turn off on its own after 30 minutes. And since there's no extra oxygen coming in there, it's really just push the button, make sure the cloud is forming, the nebulizer is going, and then of course you have to chart it in Epic. But then you're pretty much done, okay? So that's how you do these fancy schmancy aerogen inline vibrating mesh nebulizers. This is the ideal way to do it. The second, less preferred way to do it, let me turn it off here. Do a slight disassembly here. Okay, so sometimes you may see this setup, okay, with a little blue T-piece here. Well, the way this works is we will take our nebulizer that's got the medication, the little medication well. We're going to take out the T-piece, or you take out the mask if there's a mask on there. And here we have a little, so you put the medication in, so let's just do that right now. Put a little bit of medication in there. And then let's say it's like this on the patient, you'll notice that now it's kind of hard if we undo this cap. And the patient's neck is right here, it's going to be hard to, hook up the nebulizer. So sometimes you just have to sort of play around with it, like turn it this way and have it be out the side like that. And now you can put this nebulizer in the bottom. There's a spring action. And if I turn on my flow meter, you should see, if I put up against my shirt, you should see the medication coming out, okay? But again, I had to sort of adjust the circuit, twist it a little bit so that this will sit perpendicular to the bed, okay? Just be careful because the exhalation valve is here. You don't want them exhaling this stuff on you, all right? So I will mention real quickly, if you do it this old-fashioned way, if I undo the bottom here, you don't have to worry about creating a leak because there's a spring in here that remains closed, okay? So then you want to get your nebulizer ready, turn your flow meter on to 7 or 8 liters. You see your mist, and then you put it there where it needs to be, okay? So I probably should have mentioned that earlier, but you always want to have it on first and then insert it into the blue T adapter. And now you'll see it coming out here, okay? The reason why you do that is because if you assemble it and then you have the medication there and then you go over there and turn the flow meter on, by the time you come back here, the ventilator pressure will have put the medication down through the tubing. And now it's just not going to work as well, okay? You'd have to disconnect, get all the fluid out, and then reconnect. Meanwhile, pressure is still being exerted through here, and medication will be leaking out the bottom. So that's why you always want to have it turned on first, and then insert it into the T-piece. And then this will run for about 7 or 8 minutes. Because you're doing it this way, you're adding more oxygen to the circuit, so your SpO2, your monitor, should rise. So let's say you're 94% before, now you do this, you're like, oh wow, we're at 98% with our saturation. That albuterol must be helping the patient's oxygen status. Well, it's not. It's just the fact you have extra oxygen bleeding into the circuit, and that's why the oxygen level had crept up, okay? Now, obviously you can't just let this run, like set it and forget it, like you can with the Aerogen. Here, you just have to be mindful that you have to turn this off after about 7 or 8 minutes, okay? So you're in the room, you're doing your vitals or whatever you're doing, and then when you notice it's sputtering, or you notice there's no more, there's no more steam or nebulizer coming out, then you would just take it out, put the cap on, and then go over to your flow meter and turn your flow meter off, okay? And then you would just, when you're done, you'll take it over the sink and you'll just dump out, or the garbage pail, dump out the remaining residual volume. And then you'll just, there's a little bag here, but I would just say just like hang it over a hook or hang it somewhere where it won't fall on the floor. And so those are the 2 ways to do a nebulizer in line with the Bipap, with the V60 Bipap. Thank you for listening.